Hello and welcome to this presentation about the Experiential Education Student Performance Assessments in the Faculty of Pharmacy Experiential Education Placement Program. Today I'd like to go through three things with you. I want to describe how the educational assessments are designed, explain some of the reasons behind these design features, and then provide some guidance on how assessments should be completed and used. This presentation is an update on a previous presentation which contains much of the same information, however, does include new procedures around grading. The performance assessments are designed to assess 5 to 7 major areas of assessment. Within each of these major areas, between 1 and 7 individual outcomes are assessed. Each of these outcomes has a list of behaviors that are used to define what students should be able to demonstrate effectively to meet an acceptable level of performance within a given placement. So, for example, in the Year 2 community placement, the professionalism role has 5 outcomes associated with it. Within each of these 5 outcomes are going to be lists of behaviors that define what is an acceptable level of performance in the Year 2 placement for professionalism. For each of the outcomes, you are asked to provide an overall rating of the student's level of performance. The rating scale has 4 categories, from not meeting an acceptable level of performance, all the way up to exceeding an acceptable level of performance. Now, when should you be applying these ratings? Well, the logic behind how the tool is designed is that we want you to be thinking about the lists of behaviors associated with an outcome as a basis to make this decision. So, for example, if the student is not meeting an acceptable level of performance, this is a situation where when you look at the list of skills and behaviors, there are significant deficits in the student's ability to actually demonstrate those skills and abilities. That would be justification for applying and not meeting an acceptable level of performance. Now, this rating is very much meant to signal problems. So students who receive this rating, even at midpoint, we're getting a message and they're getting a message that there are some issues with their level of performance on a given outcome that may not be addressed by the end of the placement and could result in a situation where the student must be denied passing. Moving up the scale to needs improvement to reach an acceptable level of performance, this level on the rating scale is meant to be used in situations where there are multiple skills and behaviors in the list associated with an outcome that the student doesn't quite show an acceptable level of performance with, but there's an expectation with some work and practice and some feedback from a preceptor that they will achieve an acceptable level of performance by the end of the placement. And this position on the scale is one we're trying to advocate use of more often, especially at the midpoint. Moving up the scale, meets an acceptable level of performance is a situation where the student has basically showed or demonstrated an ability to perform the list of skills and behaviors associated with an outcome. There may be one or two from a longer list that the student still needs a slight level of improvement on, but for the most part, the lists of skills and behaviors associated with an outcome have been demonstrated to an acceptable level. Finally, exceeds an acceptable level of performance. This is a part of the rating scale that, again, should be used in a more limited way. This is a situation where the student has achieved all of the skills and behaviors at a level that was beyond your expectation or clearly above and beyond what you would normally expect from a student. So meeting an acceptable level of performance is, in fact, so the second one on this list here is, in fact, the level of rating that we would expect to see most in any given student. Now, the devil's really in the details with these lists of behaviors. The lists of behaviors are very important because what they do is they create some consistency between preceptors so that we standardize what the most important factors are to consider when applying a rating for any given outcome. So we're trying to reduce subjectivity. We're trying to create a common understanding of what each outcome is defined as based on these lists of behaviors. Now, the lists of behaviors are meant to change slightly from one placement to the next. And this is important because the outcomes themselves actually don't change. Finally, the lists of behaviors provide a strong basis for writing and providing diagnostic and what we call formative feedback. So If a student is struggling and you've identified one or two of the skills from the list as the basis for that, then those are the skills that should be referenced in the feedback that's provided to students at midpoint, throughout the placement where possible, and used as a basis to guide future learning and to inform areas where the student might want to be observed more or practice more. So here's what a mapping of skills across placements look like for the outcome: develops and maintains professional relationships with patients and caregivers. In year 2, community engages patients, says that it may require preceptor prompting and guidance. Moving into the 4th year of the program, we see though that the engages patients now has the word independently beside it. So being an acceptable level of performance in year 4 requires independence in engaging patients. Similarly, there's actually been an additional behavior added. The last bullet in the final column shows determines when it is ethically and professionally appropriate to involve caregivers and family members. This was not a skill that was associated with acceptable level of performance in year 2 or year 3. So you can see the outcome has stayed the same, but the lists of behaviors are modified slightly to indicate a shift towards more independence and in some cases more skill and more ability. So what is the difference between midpoint and final assessment? Well, it's the same difference between formative and summative feedback. So formative feedback is about providing information that will actually inform the learning behavior of the student. So at the midpoint, we're trying to give the students signals about their strengths and weaknesses so that they have areas of focus to improve by the time they get to the end. This is where comments are very crucial. Students need to know where they are doing well and where they are needing to improve. This is where the list of skills and behaviors come in again as a basis to write comments. And it becomes a real sort of systematic way to ensure a level of coaching and feedback provision that will guide learning. Now, when you get to the final assessment, the purpose is to make a summative judgment. Did the student do what was necessary to show an acceptable level of performance across the outcomes, and then to ultimately make a decision about whether they should pass or fail? Comments are again very important because they justify the decision being made. If a student has failed, we need to be able to look back and say, well, why did the student fail? Students do get an opportunity to repeat placements in some cases. And it's just an important thing to understand when it comes to this high stakes decision about whether students should move on. So I'd like to just review a few things about how to provide useful feedback. It's quite self-evident, and I've been alluding to it throughout. But essentially, we would go through a process of providing a rating on each of the outcomes based on whether or not you agree or disagree that the student has demonstrated the list of behaviors. If the behaviors have not been demonstrated effectively, then you're not going to be putting meets an acceptable level of performance. You're going to be putting needs improvement. And we encourage those. We encourage needs improvement because we know that our students are in the middle of a learning process. We expect them to be needing improvement at midpoint especially. So once you identified the behaviors, and there may be things that aren't on the list that you would like to highlight, but especially the things on the list, those form the basis of writing specific comments that then can be used by the students to improve. So feedback that is good and that is formative is timely, it's specific, and it also provides information about how to improve. So not able to rate is an option at midpoint. Now, this is an important option, a signal to yourself and the student to make sure that you create opportunities for these skills and behaviors to be observed between when that assessment was made and then the final placement. Not able to rate is not a negative category. It's just a way of documenting situations that need to be monitored going forward. So the final decision. This is where we've made a slight change, but it's an important change, and it's meant to promote a more honest and realistic opportunity for preceptors to apply a judgment. In order to actually pass the placement, the student now must achieve a rating of meets an acceptable level of performance on all professionalism outcomes. So this is an all or none game. When it comes to professionalism, there cannot be any needs improvements. With respect to the other outcomes on the assessment, they must have 0 ratings of not meeting an acceptable level of performance. So not meeting an acceptable level of performance on any of the outcomes is grounds for awarding a fail. Finally, the student must have no more than 3, of which a maximum of 2 are in the care provider category, outcomes that receive a rating of needs improvement to reach an acceptable level of performance. So this was not a feature of the old grading system, the old pass-fail system. In fact, in the past, students must have met an acceptable level of performance on all outcomes. But what is being acknowledged with this new process is that going from one placement to the next, there is going to be areas of needs improvement, and that's an okay thing. And in fact, there's even going to be areas of needs improvement when the students get to the end of our program. So here's an example. Working with a year 1 community placement student, it's time to complete the midpoint assessment. Assessing the first care provider outcome, the list of behaviors to consider includes engaging patients that may require some preceptor prompting and guidance, exhibiting sensitivity and respect, and empathy with patients and caregivers, identifying and responding to patient cues with preceptor guidance. We note that the student has done not as good of a job as you would have expected with behaviors 1 and 3, but you agree that they're exhibiting sensitivity and respect. And so there's some work that needs to be done regarding engaging patients and identifying and responding to patient cues. So this example sets us up for a pretty clear needs improvement assessment. Now, what if we had a little bit of a different scenario? What if we only disagreed that they were demonstrating the first behavior, engaging patients with prompting, but we agreed that they were demonstrating the other 2? Do I provide meets an acceptable level of performance at midpoint, or do I still provide a needs improvement? I think this is a personal preference choice. And at midpoint, this is something that is very much obviously up to the preceptor and the level of comfortability you have with any given student. And you would have to judge whether or not this was an area you wanted the student to really focus on going forward, given all the other outcomes that they're being assessed against. And if that was the case, you would signal that with a needs improvement. However, if you feel that they're on track and ultimately they're going to get there without any further intervention, you would be justified to put meets an acceptable level of performance. And then finally, what comments would we add to the end of the care provider section? Well, we would add comments about the 2 that we disagreed on, or the 1, whichever scenario it happened to be. So the comments would orient the student towards needing to work on engaging patients with prompting and responding to patient cues. And again, that's a pretty straightforward connection. And we're trying to create that automatic systematic connection between the reasons for categorizing students based on the overall rating scale and the list of behaviors. Once again, this is the review of the overall rating scale, which is applied to each of the outcomes, which is informed by reviewing the list of behaviors associated with each outcome. So that concludes this presentation. Thank you so much for your time. If you have any questions, feel free to contact the faculty.